Hello everyone, welcome back to a new video from MedGRADiENT, and in today's video we will be starting our neuroanatomy lessons. And basically in today's video we will be just speaking about the brain box, that is our cranium. So let's speak about the bones that make up our head, right? So this is how our skull looks right from here. Now if you see it from a distance, you feel that the whole skull is made up of just one bone, right? Now this is something which is not right. Usually this bone right here, let me make it yellow. This bone right here, it's called the mandible, right? Now everything except this mandible, right, this whole part over here is considered to be cranium. It's considered to be cranium, right? And you can consider head to be cranium plus mandible. Now again, this cranium has been divided into neurocranium and viscerocranium. Neurocranium is that part which comes in contact with the brain, and viscerocranium is that part which does not come into the contact of brain, and it just makes up the facial bone. Now in this video we'll not go in detail to each and every bone, but we will try to understand what our brain is technically made up of, right? So I mean, not the brain but the box that holds the brain, excuse me. Now externally, when you see the structure, as I told you, this whole thing is not one bone, and here in this image, though black and white, you can make out that there is one bone over here. We'll go into their names later. One over here, this bone is over here, right? This is one bone, I'm sorry, like this is the zygomatic structure. Now there is one bone over here, going deep over here. Now this is one bone, there's maxilla, then there's nasal bone, ethmoid bone, and stuff like that, right? So there are different bones. Now for that sake, let's just learn what bones they are, right? Just as the labeling is done, very simple. And how are they done? Now this is the frontal bone, everyone knows this is the frontal bone. This is the parietal bone, right? Now this is the sphenoid bone that we can see just over here, and the ethmoid bone can be seen inside over here. It's can be seen just inside the optic cavity. Then we have the temporal bone over here. Then we've got the occipital bone in the posterior part, right? Now this is the lateral view, and this is the anterior view. Now in the anterior view, you can see some other structures also. For example, this is the nasal cavity, this is the mandible. Now after sphenoid, ethmoid, you can see a small bone called vomer over here. We'll discuss it later. So this is how the whole external structure of our head is made. Now if you just open this up, you can see there is a cavity inside which has got floors, right? I don't know, at this stage, do you understand what do I mean when I say floors? You might be familiar with buildings having floors: first floor, second floor, third floor, the same way, right? So let's see the posterior view before we get into that stuff. So we spoke about the parietal bones, two in number, right and left parietal bones over here, right? Now this is our occipital bone, right? Usually, now interparietal bone is not very compulsion. There can be an interparietal bone, there may not be an interparietal bone. Now we can have one occipital bone over here, and this is the temporal part. Over here you can see these structures. Let me highlight. One is over here, they're here, and they're here, right? So what are they? So they are being labeled as Vermilion bones or sutural bones, right? you can see it, sutural bone or vermian bone. So what are they? These bones are naturally developing between the sutures. Now what is a suture? Suture is something which means it is being stitched, not like the sutures of surgery, but the sutures here in the bones of the head or the cranium are over here. You can see the superior, sagittal suture over here. You can see the lambdoid suture over here, and over here. Then you can see parieto suture and stuff like that. And this is occipital suture in case this bone exists. So there are sutures. We'll have a separate video on all the types of sutures and where are they located and how what are the kinds of sutures that you can find. Now this comes in kinds of joints, so we will have a separate video on joints. So as of now, this is the posterior view, and we've discussed what is Vermilion bone. Now, is Vermilion bone an abnormal phenomenon? No, Vermilion bones are completely normal, and they can be found anywhere between two sutures. There is no exact place of their occurrence, right? So let's go to the next page. Now, this is what we call as the calvaria. What? Calvaria, or the lid to our brain box. Let me tell you something. Now, just imagine you have a box, right? Some kind of box, some variation. You may use it as an utensil, but every box has got a lid over here, right? So similarly, our brain box or the cranium also has got the base part and the lid, right? So let's say I draw a person like this, I mean an illustration, right? So the person should technically look like this. Now, what are the bones that you might find? See, over here it has to be definitely what? The mandible, agree? And the rest part over here should be our cranium. And of course you will have teeth here, teeth here, then you have the stylomastoid thing. So this is how we actually have it. And now what I want you to understand is, let's have just simply line go through it. So everything over here becomes our brain box, and everything above this becomes the lid. So this is what exactly we are discussing, the lid of the the person's head over here, that is our calvaria. Now this calvaria has got a superior view, I mean the external view, and one internal view. So now see, this is the superior one, superior. Now in this superior you've got frontal bone, parietal bone, and occipital bone. Now you can see a vermian bone over here also, which is completely normal. They can exist anywhere, right? So externally, if you see, there are no too many structures that you can identify. What are the structures that you can identify? Now this is the coronal suture. We spoke about sagittal suture. Then we spoke about the lambdoid sutures. Now, except these sutures, we've got one point over here, it's called bregma. The other point over here is called as lambda. And except these, there nothing much important. Only one thing that is being labeled over here is these foramen over here and here. Like, I think it's too much highlighted. Let me clear things up. You can have over here and over here. So these are called as the parietal foramens, and these foramens are for the emissary veins. Now, what are emissary veins? At this point of time you don't need to know, but just remember there are some structures called as emissary veins which require the foramen called as parietal foramen. Now this is what you see it externally. Now we've cut this calvaria and we have inverted it, and this is how it looks internally. The same bones, the frontal bone, the parietal bone, and the occipital bone, right? But what I want you to understand is, internally you've got quite a few structures that you appreciate. Now, one, I told you externally there is what suture? Sagittal suture. Internally, there is something which has the name sagittal too. Now, it is called as the groove for superior sagittal sinus. Groove for what? Groove for superior sagittal sinus. This is a part of the the dural venous sinuses, not the paranasal sinuses. Paranasal sinuses come in the airway, but the dural venous sinuses are what that interests us in the neurology. So it is a groove for superior sagittal sinus. What is superior sagittal sinus? What are the other kinds of sinus like sigmoid sinus, straight sinus, transverse sinus? We'll all speak about these sinuses in a separate video. But over here, the structures that you can appreciate is the group for superior sagittal sinus, right? Now, something that's called as frontal crest. We'll discuss about it later also. It starts from there up to direct, all the way over here posteriorly until the occipital bone. Apart from that, you have got these granular fovea from the arachnoid granulation. Now, what is arachnoid granulations? How do they form these marks and all that stuff? It's all important, but we will speak about it later. Now, apart from that, you see these lines going in over here. So, what are they? They are the branches of middle meningeal vessels that are having their mark, that is the grooves for the branches of middle meningeal vessels that you can see here, right? So what are these middle meningeal vessels and all that stuff we'll study later. But as from the osteology, you just need to remember that calvaria is formed by how many bones? 4 bones: frontal, 2 parietal, and 1 occipital, right? And externally we can see coronal suture, sagittal suture, lambdoid suture. Internally we can see groove for the superior sagittal sinus. We can see the granular fovea. You can then see the sagittal suture again towards inside. Then you can see the lambdoid suture. All the sutures can be seen from inside. So this is what we learned from the calvaria. As I told you, let's say we have calvaria and we open this calvaria. What is remained below is called as the base of the skull, or the cranial base. Now, in this, what I want you to understand and the things about the floors that I was talking is that the floor where the brain rests is having a layer. What kind of layer? Let's say I draw it over here. Let me adjust the thickness. This is, we had the calvaria, we opened the calvaria, but inside this is the first floor, then something in between the second floor, and then we have the third part, I mean over here, right? The first level, the second level, and the third level. So what interests us in this? Now, what interests us is the whole brain. The frontal lobe sits here, then we have the occipital lobe sitting here, and the temporal lobe sitting like this. So this is how we have the brain sitting. In fact, we also have the cerebellum and stuff. So we have, I think I should redraw the diagram. We have something like this, like this. Then we have the cerebellum, and we have the temporal lobe sitting over here, and we have the brain stem going downwards. So this is how we technically describe brain. So the floors are very important. What do you have in the anterior cranial fossa? Now this is called as a fossa. What do you have in the anterior cranial fossa? What do you have in the middle cranial fossa? And what do you have in the posterior cranial fossa? So let's understand it. Anterior cranial fossa is everything over here. This anterior. Middle cranial fossa is this. Middle cranial fossa. And everything beyond this point is posterior cranial fossa. Do you understand? So all the structures that are labeled here are important. So let's finish them one by one. First, we spoke about the frontal crest. Yes, that we talked about in the other picture. Then we have the crista galli over here. It's of the ethmoid bone. Then we have the cribriform plate, from where we have the bulb of the olfactory nerve lying in this, and then we have the olfactory small tiny nerves getting down, not the nerve but the fibers, nerve fibers. Then we have the foramen cecum. They have the frontal nasal sinus, this is the paranasal sinuses of the bone. Then we have the superior orbital fissure over here, and then we have the optic canal going in. Then we also have the inferior orbital fissure the other way down. Then we have foramen rotundum. Then we have foramen lacerum. Then we have foramen ovale and foramen spinosum, right? Then we can see jugular foramen over here, and we have the groove for sigmoid sinus, and we have the foramen magnum, the biggest foramen, from which we have the spinal cord going down. Then we have you see this is the posterior cranial fossa I spoke about. Now the hypoglossal canal is over here, and this was our jugular foramen, if I'm not wrong. So we have the opening of internal acoustic meatus 2. So I'm sorry, I misread it. The hypoglossal canal is over here, the jugular foramen is over here, and this is our opening of internal acoustic meatus, right? So we have dorsum sellae over here, the place where the pituitary gland rests, right? Over here. I don't want to mess the diagram, but it's over here. Then you have the sphenoid bone, so it has to have a greater wing and a lesser wing. So greater wing is over here, the lesser wing is over here. And then we have the anterior clinoid process of the sphenoid bone again, so it's over here. Let me highlight this one for you. Two anterior clinoid processes, right? And then we have the anterior cranial fossa. So let's do it again. Let me clean it up for you. Yeah, so we have the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. The anterior, middle, and the cranial posterior cranial fossa. In the anterior cranial fossa, we can see that there is the cribriform palate, crista galli, and foramen cecum. Now in the middle cranial fossa is the most complex things that lie. So you've got optic canal, superior orbital fissure, foramen rotundum, foramen lacerum, ovale, and foramen spinosum. Then you have jugular foramen. Just beside jugular foramen, you should be finding hypoglossal canal the other way around. And then you have the groove for sigmoid sinus. You have the foramen magnum. Then you have the internal acoustic meatus, dorsum sellae, middle cranial fossa is this part. Yes. Now greater wing of sphenoid bone, the lesser wing of sphenoid bone, the anterior clinoid process over here, the anterior cranial fossa over here. Yes. So this is what it is. So we have learned the base of the skull very understandingly. This is what we can see from inside. Let's look at something which is from outside, right? We have just inverted the skull. We can see that there is a foramen magnum still, clearly visible. There is this foramen magnum over here. Now we all know that this is occipital bone from here. So this has to house the posterior cranial fossa, right? And then there are quite a few structures that you need to understand. For example, this is the sigmoid process, the bone. Then we have the teeth. This is a part of maxilla. Then you have the vomer bone over here, and this is the nasal passage. And the foramen, carotid foramen, the jugular foramen opening over here, the occipital condyles. Let me show you the occipital condyles quite clearly. This is where our atlas rests, atlas supports. These are our occipital condyles, right? And then you have the condylar canal just going just below them. So this was all about our video. So I hope you understood most of the things, right? So MedGRADiENT is trying to bring a great playlist. I hope you all stay connected. Thank you very much for